Hello and welcome to The Explainer. Today, we are diving deep into a diagnostic tool that is, frankly, often overlooked, but so incredibly powerful: the tongue. For you as neurotherapists, this is a game changer. It's a practical, visible window into the body's internal state that can absolutely revolutionize your assessments. There's this ancient proverb that says, the face is the mirror of the mind, and the tongue is the mirror of the body. And that idea, that's exactly what we're exploring today. The tongue offers this unfiltered, direct reflection of our physical health. It's like a map, just waiting for us to read it. Okay, so here's our roadmap for this explainer. We're going to start with the whole concept of the tongue as a body mirror. Then we'll get into the specifics of the neurotherapy tongue map. After that, and this is the fun part, we'll learn to decode the visual signs, establish a proper diagnostic protocol, and finally, connect all our findings directly to a treatment strategy. So the whole idea here is actually pretty simple, but it's also incredibly powerful. The tongue's texture, its color, its shape, all of it directly reflects the body's internal health. And because it's so richly supplied with nerves and blood vessels, it has this direct line to our internal organs, which makes it an objective sign that both you and your patient can see. And this isn't just some vague indicator. We're talking about specifics here. The tongue can help us figure out just how severe a condition is, whether a patient has a certain constitution that might respond better to one treatment over another, and, crucially, exactly which organ or system needs our immediate attention. Okay, so to make any sense of this, you're going to need a map, right? Well, in neurotherapy, there's a specific system that basically distributes the body's key points directly onto the tongue's surface. This allows us to pinpoint areas of concern with amazing accuracy. So what is this map? Well, think of it as our foundational guide. It systematically overlays the body's neurotherapy points right onto the tongue. So every little bump, any coating or discoloration, it all has a specific location and a corresponding meaning. It gives us a really clear diagnostic framework. And the layout is pretty comprehensive. The very tip corresponds to what we call the WD area, which covers uterine, prostate, and urinary health. The sides of the tongue map to the ovaries or testes. The center is all about digestion, and the very back reflects the state of the lungs and liver. See? The entire body is represented right there. Okay, so we've got our map. Now comes the fun part: becoming a detective. We're going to decode the visual clues the tongue presents. Let's explore some of the most common and significant signs you're going to encounter in your practice. All right, first up on our list of clues, cuts or cracks. These are incredibly common, and they can reveal a ton about a patient's constitution and how long their condition has been developing. And this is where the details really matter. Lots of small, minor cuts spread across the surface. That often points to a specific patient constitution where conditions tend to build up slowly. But on the other hand, a deep crack running right down the center, that's a major red flag for some long-standing digestive or even spinal problems. Next up, let's talk about the tongue's coating. This is basically the body's way of signaling that there are toxins, digestive issues, or some kind of systemic sluggishness. I mean, think of it like a layer of dust on furniture. It tells you that something just isn't being cleared away properly. And just like with the cuts, where you see the coating is everything. A thick, white coating right across the center, that points to poor digestion. If it's concentrated at the back, you might suspect lung congestion. And a yellow coating often suggests there's heat or even an infection in that corresponding system. But it's not just about what's on the tongue. The actual shape and structure of it tells a story too. Is it swollen? Are there tooth marks? Is it symmetrical? These are all critical questions to ask during your examination. So those scalloped edges that look like tooth marks, that's a classic sign of poor nutrient absorption. A W shape at the tip points right to the WD area, and this one's amazing. An unevenness or a contraction on just one side can actually reflect an old muscular injury on that same side of the body. Incredible, right? Okay, we know what to look for, but how we look is just as important, if not more so. A sloppy examination leads to a sloppy diagnosis, so following a clear protocol is absolutely essential for accuracy. These 5 steps are really your foundation for an accurate diagnosis. Proper timing is key, because you don't want food residue confusing the picture. Good lighting is non-negotiable, and this one is so important. Ask the patient to relax their tongue. A strained tongue can hide things or even create false signs. And just as important as the do's are the don'ts. These are the common traps you absolutely want to avoid. Always ask about foods that could stain the tongue, like turmeric. And please never rely on just a single sign. You have to cross-reference with the patient's reported symptoms to really confirm your diagnosis. All right, let's bring it all together. You've done a clean examination. You've avoided the common pitfalls. So now what? The goal is to translate all of our observations into a targeted, effective, and really precise neurotherapy treatment plan. This really is the million-dollar question for any practitioner, isn't it? How do we take all this data we've gathered from the tongue and turn it into a treatment that provides real, tangible relief for our patients? So let's look at an example. You see a sign, like those tooth marks on the sides. We know the implication is poor nutrient absorption. Well, that directly informs our strategy. We know we need to use treatments that improve digestion. Or similarly, a whitish tint with those minor cuts, that suggests a viral history, which points us towards formulas that address underlying infections. It's a direct line from observation to action. You can really see the difference it makes. Without tongue diagnosis, we're relying almost entirely on what the patient tells us. With it, we have objective, visible data that helps us see their underlying constitution and quickly identify which systems are sluggish. It just gets us to the root cause so much faster. Now, this is so important to remember. Tongue diagnosis is an incredibly powerful tool, but it's not a magic bullet. The source material really emphasizes that when you combine it with a full patient history, their current symptoms, and a physical assessment, your diagnostic accuracy can skyrocket. We're talking up to 100 times more accurate. And I want to leave you with a truly fascinating thought. The source material has these case studies where the tongue's appearance, cuts smoothing out, coating receding, visibly changes in just 15 minutes after the correct neurotherapy treatment. This incredible fact just begs the question, what does that say about the body's dynamic nature and the profound, immediate impact our interventions can have? So if you're personally dealing with a health issue and you think this approach might be for you, you may want to reach out to the experts at Santulan Holistic Solutions for a consultation. Thanks so much for joining us for this explainer.